Hi, I'm Ross Camidge. I'm the Director of Thoracic Oncology and the Joyce Seff Chair in Lung Cancer Research at the University of Colorado Cancer Center. So a lot of the changes in managing particularly advanced non-small cell lung cancer, and particularly in non-squamous non-small cell lung cancer, have been about identifying specific driver oncogenes. Single mutations or gene rearrangements or gene amplifications, which are the dominant driver in that cancer, if you like, the dictator of that cancer. And if you found a treatment that can inhibit the signaling coming from that driver, you can often get rapid and dramatic responses that can last a long time. But that introduces the concept of driver negative lung cancer. What is it? Well, to be honest, it's not a uniform platform. The reason being that it depends on what you've looked for. Driver negative says you don't have X. But the question is, have you also looked for Y? Have you also looked for Z? Now, what we know is that there are now 7 different molecularly specific subtypes of non-small cell lung cancer that have an FDA approval. But that's not all of the driver oncogenes that are out there. So the first thing, if somebody says you're driver negative, the first thing I would want to know is what have they looked for and what haven't they looked for? Time and time again, I get patients who come in saying there is no actionable abnormality in my cancer. Often that's how the molecular report will read because it's focused very much on the FDA approvals. But if you look down into the details of the report, you'll see something that has got amazing responses in clinical trials. It's just not FDA approved. So when you're labeled as driver negative, make sure that somebody has looked at your molecular report who knows what they're doing, can say, yes, they have looked at all of the appropriate things. They have looked at all of the things that have activity, even if they're not FDA approved. If you do end up without a driver, if there's more like a committee driving your cancer, which is often the case in squamous cancer, or you have something driving your cancer that no one's ever described, then I don't know if your outlook is going to be better or worse. You're not a uniform population. There are some people in there who will do very well and some people who won't. So I wouldn't fixate too much on the meaning of a label that says you're not something else. It's much harder to interpret that than something that says you are this. So make sure that your label is accurate and then just see how the future holds.